want to welcome everyone tonight to the Hodge Center for Discipleship. For those who don't know, my name is Bailey Scott, and I'm assisting Denise Fudge with Breakfast with Fred this week. It's a wonderful, great event that we're so excited and pleased to have almost one day under our belt, which is crazy to think about. But we have a panel before you all of some wonderful Breakfast with Fred team members who either have worked in the field or who have been patients in the field, and they would just love to talk to you all and just get to know you a little bit and get to know your aspirations for nursing, maybe what motivates you. But they have a long list of things I'm sure they would like to share with you about. But I will let them introduce themselves to you, and please feel free to share, be interactive, and if you have questions, please feel free and share. This is an open session, and so whoever would like to start introducing yourself first, I'll let
Because I'm very shy and soft-spoken, my name is Janet Boyd, and I think I'm the nurse person of the group, and with a bachelor's in gerontology of all things. Also, having been a student at Dallas Seminary, and also worked not only as a nurse but as a chaplain, and also had my own business in long-term care consulting for regulatory compliance for Medicare and Medicaid. And at one point along the way, probably most recently, was asked to serve on the pastoral staff at a large church in Dallas, which was supposed to be 20 hours a week. Well, I did 20 hours of nursing, but the truth is when you move into ministry, what happens to everything else is ministry becomes 24/7, nursing goes to the side. So having served on pastoral staff, then we moved out to East Texas, where I began to serve as a chaplain out there. And now I am back as a nurse, working every week in a clinic in Mineola for the uninsured. So you never get to leave nursing, no matter what you think. Your turn.
Well, I'm Jerry Radnauer, and I'm originally from Kentucky, a little town called Tyner, which is just east of London a little bit. You may or may not know it. And I don't know anything about medicine other than I've been a patient a number of times. And so I'm delighted to be here. I think that one of the great things about hospitals and hospital staff is that the compassion that they show for people, and I'm sure you all feel the same way. As I mentioned before, I volunteered for the Texas Scottish Rite Hospital for Children for 15 years. I spent about 4,000 hours there. And one of the thrills of my life, because these children are from ages of 1 to 18, and they have scoliosis, a very irregular spine, and they have devised a number of patents that enables them to straighten an S-curve in the spine very rapidly. There's also a device they patented for a club foot and a lengthening. They use it, you may know it, I can't ever remember it, Lazarov treatment, where they can take and they have lengthened the member as much as 6 inches. And so there's no reason for a child today to have one foot shooting longer than the other. So anyway, as I said, I'm a real estate developer. I developed industrial real estate for years, and I'm sort of semi-retired now. I still have some investment, and I have a wife's here with me and 3 kids, and 2 kids and 3 grandkids. So I'm busy, but it's a pleasure to be here. And this is the second time I've been here, and I am just overwhelmed by this campus and the faculty and the students that are here. I graduated from Eastern Kentucky University, and so it's not very far away. And so thanks for listening to us and allowing us the privilege to come here and speak to you.
Well, I'm Linda Brooks, and I have a medical background, not nursing specifically, but I graduated as a medical technologist and a registered medical technologist and worked in hematology for about 13 years after I was home with my children for 20 years. So that was a difficult thing to go back to. And when I first got out of school, it was everything manually done. And by the time I went back, everything was in machine. I felt like I was a mechanic, and it was very different. I at that time kind of wished that I had gone into nursing because I missed the patient contact. I did have some, but I went on a medical mission trip to Brazil in '94. I was not doing, we had doctors and dentists and optometrists. I did evangelism, so I wasn't doing the medical part on that trip, but I have had some experience with taking care of elderly people. I was the PON trustee for my mother's sister, my aunt, who was pretty much without anyone to help her. And at the same time, my dad was having so much memory difficulties that he ended up not being able to stay at home at the last. And then my mother also then, and she is now 97 and living 10 minutes away from us in a care center where I spend a lot of time with her. And so between the three of them, I've had a lot of association with some of the care of aging, good and bad. And I have a son who is a prosthetist. He has his own prosthetic business and has, I delight in what he does because he works with anything from young children who he enables them sometimes to be able to walk because of fitting them with an artificial limb. He fit the first paratrooper who went through paratroop school, Desert Storm person who went through paratroop school on the prosthetic leg that he made, and he was at the top of his class. So I get to hear stories from him a lot, which reminded me a little bit of what you were talking about, the things that they are able to do now that are so marvelous. And we see him change lives, and we worked with, I'll let John tell you about that rather than, I'll let him fill in on that part.
Pardon me. I've not been in the medical profession directly. Linda and, my wife of 44 years had cancer for the last 30 years. And so I dealt with a whole lot of different situations with her. We are in part-time, short-term missionaries and have been in a number of different countries. And we see a whole lot of conditions there that you would be appalled to see as medical professionals that you're growing and becoming. And yet I think it's important in this world to know that those situations exist, and physical therapists always go with us, which obviously are not nurses, but they have 7 years of training, as you probably are aware, for what they do. And we deal with a lot of different situations, and to see the perseverance of some people, and to see the helplessness of others, and the tremendous encouragement it gives, both when we share the good news of Jesus Christ with each one, and also we give the gift of mobility. And most of us don't think about that. But if you either crawl, or you're carried, or you stay put, your three options in life with your daily activities, we all enjoy leisure, we all work and function and go uninhibited in many ways. But if you're inhibited so much that that's your situation, to have wheels is just a tremendous relief. And so we our motto is we change lives one wheelchair at a time, and we do about 8,000 lives in the world every year. But of course, also their caretakers, in our case, changes their lives dramatically. We, in Cuba, for example, we were told this guy was the chief of police in Havana. He carried his son in, and his son was a big man. And just to think, what are you going to do with a loved one if they're big or small?
The mayor of Havana.
Yeah, it was mentioned in a discussion somewhere, scoliosis. Well, the mayor of Havana came to us in that country. We didn't see people starving, but we saw the absence of good medical care in many ways. Cleft palate and stuff, and these were adults, and they could have been helped a great deal as as kids. And the mayor of Havana, he could get a lot of things, but he couldn't get a simple thing like being well fitted to the proper wheelchair. And so on with many people. I don't know how much you want me to share about different situations in other countries, or how much you want us to share with family members that had problems. This is obviously not exactly nursing, but it's certainly related.
It kind of gives you an idea of some of our background if you have things that you want us to share more about.
We really wanted to take our lead from you with regard to questions.
Yes.
Because we have a lot of experience in geriatrics from different perspectives, and just even with regard to care of aging parents and how that affects us as far as careers and how we sort that out. So give us a little feedback with regard to your interest, because I know this was optional, your being here. So the fact that you're here, you had some expectation. So clue me in. Because really between us, we have a lot of diversity of life experiences and professional experiences.
We certainly do.
And ministry experiences, and we would love to pour it all on you. But we would like it to be where your area of interest is and what would be of interest to you. Be not afraid to speak. Where are you at in your course of studies?
I'm our first year nursing students.
Your first year?
It's our sophomore year in
But
school.
you, Derek?
Same. We're in the same cohort.
All the same?
Yeah.
So you're still open directionally, you're not sure where the Lord's leading you or where you're going with this? What were you going to say?
I was just saying, I kind of got my heart kind of set. I mean, I'm not sure yet. I haven't gotten there yet, but pediatrics is like what I really want to do. I worked over at CCK over in Scottsville, the Center for Courageous Kids, last summer, and each week is a kid with a new chronic illness, whether it be asthma, bronchitis, sickle cell anemia. We had muscular dystrophy one week, and I kind of just fell in love with that camp, and that's kind of where I'm at right now. I'm going to kind of be a camp nurse at one of the big old medical facilities, like one of the Paul Newman camps that he has all around the country.
Is that children with special needs?
Special
medical?
needs, medical. That's kind of where I'm at right now. That's what I really want to get into. But yeah, yes, ma'am.
Pediatrics is sort of a wide open field right now. I mean, there's really a lot of need for pediatric people in pediatrics and pediatric surgeons. I know at our hospital, we communicate a lot and trade patients with Children's Medical in Dallas, and we have once a month a surgeon come in from one of the hospitals usually, and it has to do with pediatrics because the hospital at Scottish Rite is all dealing with children. And so the last one we had was a pediatric surgeon, sports surgeon, and he was telling us about all of the pushing of youth today in sports, whether it be soccer, football, basketball, and baseball. And he was telling us that there's numerous people, kids, anywhere from 12 to 14, that they have operated on for Tommy John operation or meniscus operations. And so he's saying that there's a tremendous need for pediatric surgeons around that most people don't work in the pediatric end of it. So it's a wide open field.
In the Wheels for the World that we travel with in the wheelchair ministry, the pediatric needs are probably the greatest of what we see as well, and maybe the ones that tug at your heart the most, because there are many, many disabilities that they're born with, and then many times in some of the countries like in El Salvador, there were so many gangs there, and gunshot wounds. We saw all kinds of injuries, anywhere from brain injuries, anything on the body that related to that. But a lot of the wheelchairs that we collect, prisoners refurbish, and then they go before the teams of therapists and mechanics and support people to these countries to give the gift of mobility. We lack in pediatric chairs.
Yeah.
And they're always happy to have those because, for one thing, children grow out of them. They need lots of, they need to progress in size of wheelchair. But several years ago when we were able to go to Johnny Erickson Tata's birthday celebration in California, they were just introducing a new wheelchair that they had been able to develop that would grow with kids, and it was reasonable compared to other wheelchairs to manufacture. And so now we're not relying just on used ones, but on ones that can be used for children. They're called a Regency chair, and that's just a little bit of what we've seen in terms of.
I think you gotta have I know it's a little early for you all, but you need to have a compassion not only to excel in what you do, but have a compassion to give back. And I think one of the things that I'm more impressed with today are the young people that are going on mission trips that are helping countries. My son, I've got a younger son that's 40 years old, and he just came back from a mission trip in Cambodia. Spent 11 days over there, and all the trafficking of the girls, and he says the ones that are really deprived over there are the kids, the children. They live in the dumps, and it's going to take someone that has the compassion and loves the Lord to go in and do things like that. And we have in our church, you were talking about seminary, I lead a big Sunday school class in Dallas. That we've got elderly people. There's about 60 to 70 people in that class. And our teachers, Dr. Don Campbell, who's the former chairman of the Dallas Theological Seminary, and we, every Sunday, just about, we were praying for youth people to go out of our church into these mission areas. And my mother used to have a saying, funny, she had a saying, she says, there's always a saying, you can't take it with you, but she says you can sure send it ahead. So you just try to have a desire to give back, and just have faith in the Lord that, it's going to work out. I mean, you learn something out of tribulation all the time, and you're going to be tested, and sometimes, but always remember this, I do. I always remember, regardless of where I am and what happens and what I do, the Lord is always right there with me. So just keep your faith strong.
Sure. The beauty too of the nursing profession is that you may have a real heart right now thinking that that's the direction that you want, and you're just starting out on your education with that, and through your clinical experiences you're going to have a very broad base of experience, and find other areas too that start to stimulate your interest. That after a period of time, not only did I want to see children who got better, but I wanted to step back and move into different areas, and it's how the Lord has opened different opportunities, and I have had such a range of experiences, and realizing that I love that Philippians, that, you know, he who began a good work in you. I love that. And to realize that here I am at this point with, and see this hair? I earned this hair. Who began a good work will complete it. And to realize that, you know, I'm still a work in process. I'm still working, and the Lord's still working on me, and that will continue. And that's what's so exciting for me, that He is working on me, and I'm still working in nursing, which I have always loved, and the opportunities that are there. And what I thought and was my own determination of what I was going to do, how the Lord refined that, and that all of those things, nothing ever is wasted, and how He brings that all together in that process of refining you, and that where you start is not necessarily where the Lord intends for you to go, but just stay open and take advantage of those opportunities. I love that, because that is one of those things on our bookmark, that leadership is always about learning, and don't stop.
Always have, I make a suggestion, always have a mentor in your life. At all ages of life, there's going to be some you're going to have some difficulties and problems, but it's always nice to have somebody to talk to that you can reason your way through it, and they can help you. Now, I'm almost 70, I'll be 78 years old next month, and I'm telling you that, I know I don't look that old, but I have a mentor to this day, and that's my Sunday school teacher. And all through life, I didn't always want to go talk to my parents about things, because you know, you never want to disappoint your parents or make them have any fear or concern about you. But I always had someone that I could go talk to, whatever the problem was, and sometimes we would pray our way through it, and that even from day one. I mean, it's always been like that. So always carry someone, or have someone that you can visit with personally about whatever the problem is, or this. Don't live with it inside. You need to go talk to them about it, because all you do is, when you live with that on the inside of you, it eats at you, and then when you get in that situation, you can't think straight. You know, there's more people today, more youngsters today, that are suffering from all kinds of things, primarily depression. I mean, and it's because they don't go talk to someone about it. So be bold, and don't ever think that there's any reason you shouldn't do it. Don't be embarrassed about it. I mean, I've talked to my friends about things that I would have never shared with my parents, but you need that. You need somebody to talk to and comfort you and lead you through these struggles.
If I could just add to that too, because we know that two are better than one, right? And that Paul had his Timothy. So you need someone with a little more maturity than yourself, and it's not about age. It is about maturity in the Lord. But also, Paul had Barnabas. And so, you know that verse that says two are better than one, but it also says, and a cord of three is not easily broken. So the cord of three is Paul, you need a Timothy. So you'd have that Timothy, but you also have Barnabas. So when you find someone who has more maturity in the Lord than you do, that you can come along, who will come alongside you, you also look for that person who is that encouragement that builds you up, as well as that person. And then there's a point in time when somebody's going to be saying, you need to go out and find a Timothy. You need to find that person that you're bringing along. So you're ready when you're ready.
Are you, I think I'm hearing this right. Are you asking us to go and seek out for mentors?
Yeah, I would. I mean, I did.
Okay.
I was late in life in doing that, and I wish that I had done it earlier. Because I was raised on a farm, and I worked in the morning before I went to school. I went to school, and I worked in the evenings. I came home, and then I got to college, and I had a terrible high school education, because the teachers knew that you couldn't spend a lot of time in studying because you had to work before you went. So when I went to college, I was competing against people that students that came out of Northern Kentucky and Northern Catholic schools that had all this fine education, and I didn't have it, so I struggled. And I found the dean of the school, which I was the president of the commerce fraternity there, and the dean of the school took me under his arm, so to speak, and he led me for 4 years through college. I mean, every time I had a problem, he laid his life right out in front of me and said, look, I've had some problems. Come see me and talk to me about it. And I went to him quite frequently because I always had difficulties. I did studying, I could have a problem with this subject, and he always carried me through it. So and it's followed me to this day. So I'm suggesting that you find someone that you can talk to, that when you have difficulties or you have a problem or something you're concerned about, that you can go to them, talk to them, and they'll listen to you and talk to you.
There's a comfort in that relationship. In other words, it doesn't have to be awkward. You will find that relationship that works. Years ago, 2 young women invited me out to lunch, and we're having lunch, and they began to tell me that they were looking for an older woman to mentor them. This was a few years ago, and I'm looking around the room thinking, who do they mean as an older woman, you know? And they were talking to me. But it was the idea that they were looking. It wasn't my coming out and tapping them, but there's no rule that says it has to be one way or the other. It's the people that you cross paths with, and you meet somebody and you say, I like that person, or I see something there. I mentor, and I wrote a manual for nurses as far as mentoring that new nurses coming in, so that it was like a buddy system. But it's the idea that we need somebody who is willing to come alongside us and help us, you know, work that new system or fall into place, or, you know, whatever it is. We need that in the Lord, that we need somebody to walk with us along that way. So I have been blessed that there's always been somebody who has come up and said, will you mentor me? And it always surprises me. I'm never prepared for it in terms of I never would have picked or chosen that person. And I have been for the last 2 years mentoring a young woman who just came off of mercy ships. Her husband is a dentist, and she is a nurse, and her only experience has been on mercy ships. But she wanted, and I thought, wow, you know, this is an exciting young woman, but she had not walked with the Lord very long. So it wasn't mentor me in my nursing, it's mentor me in my walk with the Lord. And it's such a privilege to be able to speak into somebody's life like that and encourage them in the Lord. And she has just started at Dallas Seminary. So, you know, to have a part in someone's life like that.
I think so much of this goes along with mentoring. This is called the Breakfast with Fred seminar, as you know, or leadership conference, I should say. And one of his principles was, and the first part of it sounds like, wow, really? He said that God will not give you strength to overcome, but He will give you strength as you overcome. And I think in nursing, as in so many parts of life, a great function that we can have is is an encourager and helping people to give them the concept that they can have strength and overcome. I've seen so much of this in my life. I mentioned that my wife had cancer for 30 years, and when she first realized she had cancer, she was a young woman of 34 years old, and she was so convinced after her first surgery that showed that it had metastasized somewhat from the adenoidal carcinoma she initially had, that she was convinced that she would not live to the next Christmas. And so she made me follow her around and see where she put away Christmas gifts. And I don't mean gifts, I mean decorations. because she knew she wouldn't be there the next year. And we laid this before the Lord, our whole situation. We had a 2-year-old, a 7-year-old, and an 11 and a 13-year-old. And we asked God if He would give us Janet, their mom, until this little 2-year-old girl graduated from high school and was 18. But God in His mercy gave us that little 2-year-old until she was a 32-year-old woman before her mom went to be with the Lord. But Janet changed her attitude very early on, in that she spent so much of those 30 years encouraging other people. She had a platform that you and I don't have, because she was walking in those shoes. And she would, for instance, go to radiation on a regular thing, and everybody there had cancer for radiation. She would put on a fresh dress. She would take flowers, never ask for people. She'd take fresh flowers and leave them there. And, they'd say, well, how long have you had it? And they'd say, how long have you? She'd say, 15 years. Well, I think that kind of in general, people think, I have cancer, I won't be here tomorrow. And a few people aren't here tomorrow, but they're an awful lot, as we all know. And she would encourage people so much that there was a man that had cancer, and it was just eating his heart out. I mean, the cancer wasn't, but the whole discouragement of where his life was, he lost control of life. And he came to our house as a broken man. He knew Janet had cancer, and that night he fell on his knees and gave his life to Jesus Christ. She spread her attitude, and she's had roommates in hospitals and other things that she encouraged so much. And when they would, ask her about where she got her strength, well, she would say she got her strength from the Lord. And so she used that platform that she had. I think of other people that have allowed the Lord to give them strength as they overcame. Linda's daughter, Laura, is a wonderful person, and her first baby has Down syndrome. And I think if anyone that had any child, but especially your first one, this is a wonderful thing. And here this child had Down syndrome. Well, that little girl is 21 just this month. And Laura has just led her and developed her to the max that she could. She's actually going to Northern, Kentucky Northern University, a special program, and she's seen that she developed. She's had speech since she was a tiny girl, and she's just helped her in every way. She gets paid for a job she has at the college, and she's pushed her, that's not a good word, she encouraged her and led her to develop to the max. She's never going to be here, but whether she can be here or here, she's going to find the highest rung she can. And I think of God, again, working us through so much, giving us strength to get through. My youngest daughter, Amy, had a very difficult thing in her life. She went to a Christian school, a respected school, and I still respect the school. And when she first came home, after having been there for a semester or something, we said, what are the kids like there? And she said, well, a third of them say they're not Christians. And she said another third say they are Christians, and she said the other third says they are, but they're really not. And she married one of those said you are, but is really not. And it was a horrible experience for 14 years of her life until that man's infidelity broke it up. And then she had a really good husband, and a year and a half ago, he had a stroke. And so part of his mind's gone, he's incapacitated, and so it's put on her to be she's breadwinner, to be mom, to a 12-year-old and a 16, and then a couple of kids in college in different directions. But she gets strength from the Lord, and God has really given her strength and she doesn't say poor me, and you don't see her in tears, but she's a 24/7 care and doing everything else. So I think I see so many people that, again, I think as a nurse, that you'll have countless opportunities. Fred Smith, Brenda, you correct me if I leave out the essentials in this, but he tells about having been in and by the way, I've heard him called a name here, and that name is the wisest man in the world. And even if he's in second place, that's pretty good. We've all met somebody that is convinced he's in the first place. Anyway, he relates that when he was a very serious surgery, and he went to Mayo Clinic in Rochester, Minneapolis. I'm saying not in wrong. He went to Minneapolis to Mayo Clinic, and he was in there for some time, over a week, and he gives more than a hint in his rendition that he's his wife and Linda's mom, and he was generally considered as a controlling person, but certainly in fine ways. Anyway, when he went in the hospital, he said he had to put his valuables in a box and his billfold and his ring and whatever else in this box. And it's kind of like he undressed his self-assurance there, and and it was a healthy thing in his case. And I can't say enough good about that man, but he obviously did so much good to so many people and influenced so many. But so one night, in the middle of the night, literally, a nurse came into his room, and she was very hesitant and said, I have never asked anybody this before, but he said there is a woman, a young woman, down the hall, and she's dying, and she has no one there with her, and she has not a flower, and you have 19 beautiful flower arrangements. May I take one of these down to this woman? And Fred said, I'm sure, or something to that effect. And this woman, the nurse came back a little later, and she was, I believe, in tears. And Fred said she came over and tugged on my big toe. And she said, I think he was saying, we did something good tonight, didn't we? And he says, I think I just need God to say, and I need to, in life, to tug my big toe and say, we did something good today. And he's kind of laying before you and me that as a nurse, you will have countless opportunities to do something that's not in the book, and you can say, Lord, we did something good today, didn't we? And then I can go on and on about so many difficult situations. I'll try to stop talking in a minute, but I sometimes say, when we were in Cambodia, that's a country where between a third and a fourth of the citizens were killed by their own countrymen in the 70s, and you said that's where back, who cares? Well, in that country, you can pretty well assume that every family had an aunt or an uncle or a mom or dad or a son or a daughter or grandma or whomever that was mercilessly killed. And this, what emotional scars, but also they have more landmines than any per person. No, it's a small country, per person in any country on earth they did at that time. There were teams of minesweepers that were coming, NGO, non-governmental agencies, like a team from Belgium was there, and they were getting ready to go home, and somebody else, minesweepers. But at any rate, the point I want to say, so there are a lot of people with only one limb or their foot blown off or both legs or whatever, but the medical care in that country, you can, I'll almost say it the other way around, you can count on the fact that you will have poor medical care or incompetent because the doctors there can get their degree by bribery. There's so many horrible things in the world, and just to be, realistic. They have a huge need, but boy, you better go to Thailand or someplace if you have anything serious. And my list of stories I'll put back in my pocket.
It's good to hear from you, John.
Don't you all
It
have
is
a
good.
question? Don't you all have
Yeah.
some questions? You have?
I'm not a student, but can I ask a question?
Yes.
I really like what you were saying about finding a mentor. And
Yeah.
I think that would really help you through nursing school, but then also once you become a nurse as well. But I do have a question, since most of you have either been a nurse or in the caregiver role, and you've talked about the effect of staying positive and how that affects pretty much the outcome for the patient. How, as a healthcare provider, as a nurse, how can you encourage that patient to stay positive, or how can you encourage the family to stay positive when they're facing such, dilemmas in their life? What words of advice would you kind of guide us students and for that?
I guess when I look back at some of those experiences at Sloan, where I said we had an extremely high mortality rate, because when you're on that unit every day, you're building a relationship. And I recall particularly a little boy who was 18 months old, who had leukemia and was also Downs. And the parents lived in upstate New York, so they were not there because there were other children. And he was mine. I took care of him every day. He was mine. And I won't tell you this without tears, because it chokes me. So how do you help the parents in this? Because they realized that as I cared for him, it was all wrapped up in that word care. I wanted to see him free of pain. I wanted him to see and receive every aspect of his treatment. I wanted to see him well. And I will tell you that when he was dying, they called me to come over as they called the parents. And I rocked him all night as he died. And when the parents got there in the morning, we were all a mess. We were all a mess. And they thanked me for being there. And so, how do you help the parents? By loving the child that you're caring for. And that's what it's all about. And that's the only way I could work like that, was to care. And I prayed that I would never lose that. You see, I can't. That's still a hard memory. That I could be flip and silly and carry on, but when it came right down to it, I loved what I was doing, and I really felt I was contributing. And that family knew it, and they had said to me afterward, we knew that we might not make it in time, and we were so thankful that you were there. That's what's important, and that they know that, and that you can do that with every child, even the one that bites you and chews on you and spits at you, that you do that with all. And then when you move out of that and you're dealing with adults, I think that compassionate heart doesn't stay back there in peds. It goes with you everywhere that you go. And in those moments in time when you're dealing with patients in real crises and real emotional crisis because of their own diagnosis, they know whether you care and how much you care.
I would say that's true in probably anything you could name. The little ones in the foreign countries that we hold when we are even there a short time. And I've seen it with my mom, who's 97, and she's not ill. She's just aging and getting more and more feeble, and her mind doesn't work very well. But she knows, even though she can't always track with things, she knows that I'm there, and she doesn't really even care if I talk a lot or just being there and in my presence and showing her love I can tell, makes a huge difference to her.
Yeah.
And she can't follow a lot of things that you try to have conversation, but when you get her, you can be there very quiet. When you get ready to leave, she knows that you're leaving, and she expresses what it means to her that you're there.
I think it takes a very special person to be a nurse. Someone who has a lot of compassion, a lot of love, and one that can stand or withstand the emotional aspect of being a nurse, depending on whereabouts you are. But if you're in a situation like her, that is tough. I don't know. I don't think I could deal with that. But people who do that, I admire. I see even at Scottish Rite, and we don't have any types of injuries like that. But I see one. I'll give you one example. One day I was going down the aisle, and a little boy was in a nursing in the room in his bed, and as I walked by, and I had a special jacket on, as I walked by, he said, "Say, mister," said, "you want to see my new leg?" And I backed up and I said, "Sure, I want to see it." And he come running out of that room, and right behind him was his mother and his father. And this Texas Scottish Rite Hospital never charges children, never charges the patient. It's not free. Somebody's paying for it, but it's not the parents. And they came out in tears saying that their father had an implement store in West Texas, and they barely made a living, and that they just wanted to appreciate, they knew that this child could never get what we gave him, what the hospital gave him, without the hospital. So even me, Patricia was with me and brought tears to both of our eyes because they were so appreciative. But those are emotional situations that you just got to be able to deal with, and it's tough. And I think being a nurse is a very wonderful, compassionate individual that does that. And you ought to be admired if you go through it and do that. And yes, you want to ask a question?
Yeah, I just had a question. Kind of going on the love thing. How do you folks go about loving the people that not the easy people that are easy to love?
The unlovables?
Not the people that are easygoing, that love you back. But what about the people that don't love you back, that give you a hard time, that hit you in the face when you're trying to take care of them, or spit on you, or things of that nature? How do you go about still loving those people and still showing them the compassion? Because I guess I like to think those are the people that need just as much loving as those that are.
We had one of them, and pardon me if you asked.
Sure,
me
no,
to
go
say.
ahead, John.
We had one of them in Peru. And we were divided into teams with a therapist, a mechanic, a wheelchair mechanic, and a support person, and a translator. And anyhow, one was brought to our team who was worse than irrational. The therapist could not evaluate this man properly because he was violent, actually. And so finally, at some point, a couple of us, and this sounds crazy, but it's there, we had to deal with it. We wrestled into the floor, and we never wrestled anybody, but we had to this man, and there was a blanket or pad on the floor, and one man was we had him out like this, and one man was holding one hand or arm, and I was holding the other, and he came so close to bite. She kept trying to bite us, and he came so close that his saliva was on my hand, but he didn't ever bite either of us. And so to love that person, well, the way we handled it, we did the best we could. After some time of this, somebody relieved me, and they were able to get him quiet enough that they could fit him to a wheelchair, and his poor mother was his caretaker, apparently without a dad, and they met some police on the way home who took the mother and the adult man who was worse than irrational, and took him home. And we did the best we could. I don't know, that's not the whole answer, but we did the best we could.
I hate to break this up because it's getting such great conversation and you all are really making connections, and feel free to get their contact info or we can give that information to you. But there is an event that you all are more than welcome to attend. It's at 8 o'clock. It's in Slider Recital Hall. It's the concert choir is going to give their presentation that they gave on Sunday at the Mark Twain performance, so if you'd like to join us. But we do need to close down this session at this time. I'm sorry. It was getting so
We
good.
were just getting warmed up.
Yes. But thank you all so very much for coming, for sure. Thank you.
Thank you.
Thank you.